Everyone, this is Avinash and I'm from Tiyo. Today we'll be going to discuss about nose bleeding, which is very common during summers, and we have Kolkata's eminent ENT specialist, Dr. Shaswati Sengupta, with us. Welcome, ma'am.
Thank you.
So, ma'am, my first question regarding this issue is why does a nose bleed when actually I have or anyone doesn't have an injury?
Well, to understand the prominent causes of nosebleed, you have to first understand the basic physiology of nose. Okay, so what we do when we inhale, the air gushes inside the nose, and during this particular inspiration phase, the air goes through middle portion of the nose. Majority portion of air goes to the middle part of the nose. Okay, and when we exhale, that is when the breath comes out, it goes in a various arch like fashion. Inside our nose there are two parts, that is the right and left side. It is divided by a septum. Okay. That is a type of wall. It is constituted with bones, that is, and part of soft cartilage, and covered with mucoperiosteum and mucopericondyl. That means bone and cartilage covered with its corresponding layers, and above that there are very soft type of covering known as mucosa. So in summers or in any particular season, it is more common in summer and sometimes in winter also, when there is dry air, that is the humidity of the air is decreasing. Okay, for example winter or in the early part of summer, then this dry air causes dryness inside this mucosa. In normal physiological state, the mucosa remains moist. When it becomes dry, it becomes more prone to bleeding. Why? Because the blood vessels in the septum, they underlies just beneath the mucosa. Okay. So whenever there is any dryness of the mucosa, there is easy breach, that is crack like lesion. Okay. And this crack like lesion then start to bleed with minimal manipulation. For example, in cases of children, it is very common nose bleeding due to nose pricking. They have a habit to put anything in nose, including their finger and fingernail trauma. Even in some cases of adults, it is also common, this fingernail trauma. Second thing is that this nasal septum, it usually has some kind of curviness in it. In some people, the curviness is more. Okay. That is, it is not a straight line fashion. Okay. When the curviness becomes more, it is known as deviated nasal septum, because it is deviated either on the left side or on the right side or on both sides. Okay. So when the septum is deviated, this inflow of air directly strike on the deviated part. That is the most prominent part of the septum. And on on repetition of this strike, particularly with dry air, it becomes more prone to injury and more prone to breakage and resulting bleeding. Okay, and one more thing is that when there is dryness, when there is any kind of nose pricking or any type of manipulation, there is production of crusting, and when we remove this crust, there is bleeding. Okay. These are the most two common thing. Okay. And some cases there are some type of tumor, particularly in young boys, in teenage group of boys, and some cases there is some granulomatous disease, some bleeding polyps in nose, small bleeding tumor are there. They are also common, but not that much.
And ma'am, my second question is, what is the prognosis of nose bleeding?
Nose bleeding, look, the thing is that nose bleeding is an acute stage. When it bleeds, it becomes a big problem to the person and his family member. And it is, for example, if a person is hypertensive, that is, he or she has high blood pressure. Sometimes this high blood pressure causes breakage of the bleeders in the nose and related nose bleeding. So what this type of nose bleeding is controllable. When the BP does not fluctuate, with BP is normalized after some medication and other primary care, then it can be stopped. Second common cause is that I have already said, that nose pricking and dryness of nose. They can be controlled with some preventive measures like repeated saline nasal spray or drop in cases of children, and willful stoppage of nose manipulation. Okay. Third thing is that there may be some disease, nose-related disease like deviated nasal septum or some bleeding tumor in the nose. They need definitive surgery, because without surgery, these things are not curable. A tumor cannot reduce, a deviated nasal septum cannot be straightened without surgery. So people sometimes get frightened just hearing about surgery. This should be these people should be provided with proper medical as well as counseling, medical care and counseling, so that they understand the surgery is very much indeed needed to recovery from this recurrent nose bleeding.
Okay, one more question is, a lot of people start panicking when they actually bleed from their nose. So, what are the basic first aid measures one should adopt?
Um, Look, the thing is that being panicked after seeing such nosebleed, it's quite common and natural.
Okay.
So you cannot stop panicking. But after you have been panicked, you as well as your family member or the person nearby you can take some simple measures that will control to some extent that nosebleed, depending upon the cause. Okay. For example, hypertensive nosebleed, that is the nose bleeding caused by increased BP, you have to first pinch your nose. Okay, in any type of nose bleeding, you have to just pinch your nose like this will not do. You have to pinch like this, so that these two parts, lateral two side part of your nose, they become compressed with the central part. So it will produce a compressor effect, and you have to bend down and gently breathe through your mouth like this. If possible, take a bowl or a tray in front of you, because when you will press like this, the bleeding will go through your posterior part of nose and it will come through your mouth. Then you can spit out the bleeding in the pot, or you can go through the near the basin also. And as well, at the same time, you should put some cold pack in the surrounding region, like you are pinching this and putting some ice pack in this region. Okay, like this. And the second thing is, you should search for nearest medical facility as soon as possible. These are primary measures that you can take at home. Okay. And for example, you can put some ice pack over your nose, you can pinch your nose, and as well as you should always continue your BP medication, blood pressure medication. You should not miss your dose. And sometimes if there is some injury, always please don't manipulate it any further. Sometimes what people do, they are clot, that is the dry clotted blood inside the nose, and it has blocked nose, so that person cannot breathe through nose. And so what he tries, he removes that clot. This removal of clot again produces bleeding, so don't manipulate that area. So number one is pinching your nose, cold compress on the nose. Third is try to be relaxed and breathe gently through your mouth. If blood collects inside your mouth, spit it out. Okay, and have some cold water, and if possible, take some PPI, that is known as some like pantoprazole, omeprazole group of medication, because it is quite common to ingest some of this blood, and this blood will irritate the stomach, and there may be some kind of blood vomiting, which is much more dangerous or much more anxiety producing element for the patient. And of course, reach the nearest medical facility as soon as possible. because doctor or sister will give you some medication which is not possible to be given at home. So that is very important.
People sometimes blame the weather. They say that in summers we generally have nose bleeding, and is it a myth or actually
No,
summer is
no,
to be blamed?
it's people are definitely correct.
Okay.
Okay, so as I have already mentioned before, that in the initial part of summer, there are drought. Drought means blast of dry air, hot air. I think you have already heard that these kind of things are more common in extreme climate region people. Like in West Bengal, they are more common in the western part of the state, like Purulia, Bankura, Birbhum, this kind of thing. Even nowadays in Kolkata, we are having a kind of dry summer for last 2 years. So it's quite common in case of school children or people who regularly have to go out for their various jobs or for their schools or colleges. So it is quite common in summer as well as in winter also, but yeah, it's summer.
What can one do, or what measures one should take to prevent this?
Look, the thing is that if you have some anatomical defects like deviated nasal septum or some pathology like any type of nasal tumor, some bleeding polyps or papilloma, even in some cases there is a thing known as rhinosporidiosis which produces torrential bleeding through nose. It is kind of water related disease. People who take regular bathing in ponds where cattle are also being bathed, they are quite common, and it is sometimes common in long term swimmers. Okay, so if you have this kind of thing, any anatomical or pathological deformity, then you have to remove that problem. Otherwise there will be recurrent nosebleed. Number one. Second thing, if you don't have that kind of extreme possibilities like some deviated septum or tumor, then the cause may be some systemic, like raised blood pressure. Even in some cases, if there are some bleeding diathesis, or that is blood related problem where the blood does not clot easily. Okay, there they are not quite common, but I have or usually all medical doctors have seen such cases, as well as some renal problems. These systemic problems are also related with this kind of nose bleeding, so you need some medication for that. Number three is that the common causes of nose bleeding, like nose pricking, minor trauma, or simple dry air. So you have to take some preventive measures for that. What kind of preventive measures? First of all, when you are going out, please put a mask or at least a dupatta or your handkerchief over your nose so that you don't have to face the hot air blast. Okay. Second thing is hydration. Hydration both systemic and local. Systemic hydration means you have to drink lots of water. Water means direct drinking water or any type of fluid like dal, curd, different not cold drinks. Cold drinks is not exactly a water supplement. Fruit juices, but obviously with water. All these things, including green coconut water. So you have to keep your system hydrated. As well as for local action, you need to put some normal saline drop. They are cheap and easily available in all medical stores, and they don't have any type of side effect. It is just equivalent to our body fluid. So you put some normal saline drop, and if you have recurrent attacks of nosebleed, please carry with you a normal saline nasal spray. Okay, so they are not that much cheap, but one bottle run at least 1 or 2 months. So overall, it is not that much costly. So you can carry it with yourself, and you can put your drops or spray at least 3-4 times per day. So these are all preventive measures. Okay, and I think these things should be should be kept in mind regularly, because you continue for 2 days and then stop for 2 weeks, that does not ultimately have any effect over
Actually.
you.
So thank you so much, ma'am, for enlightening us and our viewers. This is me, Avinash, signing off. You don't forget to like our Facebook, Twitter, LinkedIn, Pinterest, and Instagram page, and subscribe us on YouTube channel. Bye bye.